My name is Bianca Martinez, and for Module 8, our signature assignment was to complete a TED Talk video focusing on a clinical problem that we had decided to work on for our research evidence-based practice class. So the clinical problem I had focused on for the last 8 weeks is the mental well-being of nurses during the COVID-19 pandemic. Unlike SARS, known as severe acute respiratory syndrome, which affected young and middle-aged people, the novel coronavirus at first attacked the elderly population in those with chronic conditions such as diabetes and hypertension. Nurses were faced with the difficulty of having to care for the COVID-19 patients without the proper personal protective equipment known as PPE. They weren't giving the proper masks such as N95 masks, or they've had to reuse them, making them susceptible to themselves becoming infected with the virus. The nursing shortage has always been around, but with the beginning or since the beginning of the COVID pandemic, I personally feel like it has exacerbated the shortage as nurses were having to pick up more shifts. Their patient loads were becoming more than what they usually were, that this caused nurses to burn out or choose to leave the field altogether, especially when nurses are not used to losing patients at such a high rate on a daily basis. It made me think if this caused some trauma for them, because all healthcare professionals are not just trained to handle patient loss, but when there are high numbers, and I personally feel like there's only so much a person can handle that until it starts affecting them mentally and physically. So with this nurses shortage just being exacerbated by the pandemic, the need for more nurses, CNAs, was exacerbated, that they're highly needed now. That in the beginning, nurses that were, I believe, a month or two out to graduating were already being pulled into the hospitals. Now they're having students, actually nursing students, even go help them on the floors. And I was actually one of those students that for the past 4 weeks I had to go for my critical care clinicals and help on the COVID unit, which at first I was a little intimidated, but just seeing and meeting the different nurses on the floor, I actually learned that many of them were travel nurses. And the staff that's actually there was on a shortage, so they depended a lot on the travel nurses to come and provide their assistance. And describing the operational practice in the environment that I have chosen, with the COVID pandemic being so new, there were several studies that I was able to look throughout and research throughout the last 8 weeks. And one of them was that many nurses actually developed anxiety when thinking of death. With that again being of the patients dying at such high rates, and even patients of all ages, young patients that had no comorbidities, just being taken over by this virus and not being able to fight it off. To keep the staff from, especially the nurses, from leaving the field, I believe that some sort of mental health services should be provided for them. The important thing is that when someone thinks of mental health services, I always feel like there's some kind of stigma faced with it. So I would feel like it's important to let them know that there is nothing wrong with seeking help, that we know self-care is important, especially to the nurses, that just having someone to talk to, getting everything off their chest will help keep them from keeping all those feelings internalized, causing them to eventually burn out or potentially leave the field. We need the nurses that are there ready to help train and mentor the nurses entering the field, because they're coming at a time where many of them haven't had a lot of hands-on experience with patients because of the pandemic. In one way, I also think encouraging self-care is important to the nurses is at least having 1 weekend off a month and potentially 2 weeks off every 6 months to a year, just so this gives them time to step away and not think of the hospital. I believe it's always important, or some have said that when you're at work, all you think about is at work. So the moment you leave work at work. You don't bring that home, which right now I believe it can be kind of tough for them, especially when they know they're so short staffed or the numbers are going back up, that patients are being double bunked in all the rooms. No rooms are single rooms. And as soon as you discharge a patient, another patient immediately fills it. So this can really take a toll on all the nurses, especially when they think they're going to get just that little moment just to breathe. And boom, they're getting another patient. And some patients, even on the COVID unit that I was on, it was the PCU floor. There were some patients that were asymptomatic, that were simply there because they tested positive, and other patients that were on either a high flow and eventually heading to a BiPAP, or I had a couple patients that were already on the BiPAP. And from the nurses' experience that were there, I learned that the BiPAP is the last step that you go on before you have to be moved to the ICU and potentially be put on a ventilator. So self-care is definitely one way to help keep our nurses safe and healthy physically and mentally, to keep them from leaving the field. And how do we overcome these barriers? A barrier that I had encountered during the pandemic is simply patients trying to get seen by their physicians. Most physicians were not seeing their patients, or eventually they got approved to do telehealth, which is basically doing a video chat with their patients. And in some cases, this was actually a good thing that happened, because our elderly patients that had other potentially conditions were afraid to simply get sick by going outside, that they weren't risking themselves by just being able to have a video appointment with their physicians. And many hospitals actually had to push back elective surgeries simply because there was no room for them, or many of the ventilators were all being used and the hospital was filled to capacity. So elective surgery, or if you could wait, they were likely going to push you back from having that procedure done while the COVID numbers were at a high rate. And sources of the internal evidence that I use providing and how to implement these improvements is there was a qualitative study done that I actually got to view, was where researchers completed a survey, a telephone survey actually, when the participants, who all happened to be nurses, were selected and were interviewed over the phone while they were not on shift, because they did not want to distract them or keep them away too long from their patients. And they were also at risk just being on the COVID floor if they didn't need to be. But I thought it was actually really important to speak to the nurses who have been working the front lines of the COVID pandemics, because they have firsthand knowledge of what needs to be done, should be changed, and the improvements that need to be implemented. So actually, if the researchers, once they gather all their information and they use that to help hospitals overcome the improvements that need to be completed, will make the nurses feel like they're actually being heard and cared for. meaning if they feel like they're safe and their feelings are actually being validated, they're likely to keep working, be happy, and not leave the field. And when nurses are happy, loving what they do, they are likely to be less snappy with their patients, and their patient care will keep up instead of it going down, as nurses have been doing with their patient-centered care, because they were simply being overworked, exhausted, causing them to snap at them fellow nurses and, worst of all, their patients. Ethical considerations during the pandemic, the major one that I can think of is when hospitals had to begin to mandate all workers to be vaccinated for the COVID virus. At first, I believe it was optional to those who wanted to receive it. They were provided it, but many people still didn't receive the vaccine, as the numbers were simply not going down, or they were still elevated. Many hospitals all throughout the state of Arizona mandated that all employees were going to have to be vaccinated. Some were provided, or they said you can apply for a exempt for religion or medical reasons. And for those, I believe, that actually received it or completed an exempt form, not all were approved, very few were. So for those that weren't approved, were either left with the choice of receiving the vaccine or losing their job. And at first, I didn't know honestly how to feel about that. I believe it should be their choice to receive it, especially if they have been working during the pandemic since it started. That should be their choice if they want to choose it. But that was a big ethical issue that hospitals have faced during the pandemic. And how to evaluate my outcomes, similar to how the quality study I've done, was to complete a survey reviewing all the responses of the nurses and seeing how many of them stated the same things or improvements needed to be done will help me keep track of writing it out, setting up a plan, providing it to the hospital, and monitoring how those improvements either were helping or didn't make a difference. If we did have such a big improvement and all the changes implemented had a positive outcome, I believe it would be a smart idea to send it to other hospitals so they can try to make the changes and see if they had the same positive outcomes we had. And how would I decimate the findings? Like I previously said, depending on the outcome that we've had of the plan set from the opinions that nurses had given us of what needs to be done or what isn't helping or what is helping us set up a plan, implementing it to the hospital where we are at, monitoring the progress. If it's a positive outcome, great, write up the notes and send the memo out to other hospitals. Or if the outcomes are not all there or seem to be trending downward, we can always go back, make the changes, and once again implement that again and see if it goes up to the positive way or go back negative way. That way all the hospitals have the same plan set in place, hoping to get the same great care that our patients are receiving, and nurses again are doing well physically and mentally, knowing that their needs are also being met to ensure their protection is being met. Thank you.